Governments and health ministries in Europe are now on high alert as the first case of Ebola contracted outside Africa is confirmed. The Spanish nursing assistant has been transported now to a specialized ward in a Madrid hospital. The woman had treated a Spanish priest and a missionary worker last month, both of whom had fallen ill in West Africa. The nurse's husband and her co-worker at the hospital are among 3 more potential Ebola cases that are currently being monitored. Alarmingly, the Centers for Disease Control says that if the virus is not stopped quickly, Africa could see over 1 million cases by January. Now, Ebola has already killed more than 3,400 people and infected 7,500 more, mostly in these 3 West African nations. The majority are in Liberia, where the United States is now sending 3,000 troops to train and equip staff and also to build field hospitals to treat the epidemic. The Pentagon today admitted that it faces huge challenges there.
As you can imagine, their whole nation is overwhelmed. Their health facilities are overwhelmed. That's all broken down. So we have to bring in everything at the same time.
Not to mention taking a massive toll on the fragile nation's struggling economy. Earlier, I spoke to Liberia's ambassador to Britain, who tells me that what his country really needs most is a well-coordinated plan of attack. Ambassador, welcome to the program.
Thank you.
Liberia is obviously the hardest hit country. According to all the international health officials, more than 2,000 Liberians have been killed because of this. It's because of the breakdown in your healthcare system. You only had 200 doctors for 4 million people to try to deal with this, and now only 50 doctors left. How can you even begin to get a grip on this?
We have no choice. That's even better than what we met in when President Sirleaf got in. When President Sirleaf got in, we had 7 doctors, practicing Liberian doctors.
7?
7 practicing Liberian doctors. By the time the Ebola situation got on, we were about almost 200 doctors. So we were climbing slowly but surely. Yeah, it is that bad.
It is that bad.
It is.
And now we understand there are even fewer doctors. Some have died, apparently, some because of the fear and have left. But here's the question. Has the U.S. intervention, the fact that part of the help cell is based in Monrovia, has it made a difference?
Well, the fact that the Americans are coming, it's a sign of relief. But however, we cannot rest on our laurels on that. We cannot just sit and fold our arms and say, aha, the Americans are here. We can't do that. So what we're doing, we are being innovative the best way we can until the Americans actually get on the ground.
You say you're being innovative even before they get on the ground. What do you mean?
I'll give you an example. We just found a student nurse who was a senior student at one of our universities. She, on her own, decided that she would take on this Ebola to save her family. For example, she used simple methods by simply using plastic, not gloves. She didn't have the gloves. She didn't have access to the gloves. So she put plastic around her arms, plastic around her, and put on as a protective gear. Ended up actually saving her mother, saving her father, and saving her brother.
Does it sort of break your heart that Nigeria, which is obviously the most populous country in Africa, the richest country in Africa, managed to get a grip on their relatively small Ebola cases and prevent it from spreading because of their health service, because of the help they'd had from outside, the ability to send Ebola investigators out to, I don't know, as many as 900 people who may have been in contact with the several who were infected?
Well, Nigeria was able to do that. One thing you must realize, the Ebola situation is very capital intensive. It's a lot of money, and I mean, Nigeria, we all know, Nigeria has the finances to do it on her own. We don't. We are coming out of a disastrous situation of 14 years. The world knows that. We were trying to climb out of the situation bit by bit. Then Ebola comes on. What do?
So what lesson have you learned for the future? Is there any way that you can put into practice better practices for the future?
First of all, we have to continue with the awareness campaign that is in our various communities. And it's going, that message, it's now being sold throughout Liberia. The communities, at the community level, they're all getting the message slowly but surely. We've trickled it down to kids, to everyone, because we had a major problem of, first of all, not accepting that Ebola exists. Now they are accepting it. Now they're trying to be careful in self-hygiene, washing your hands properly. These are simple methods.
Obviously, the economy is massively important for any country. The finance minister of Nigeria has said that it's sort of having a contagion of fear and potentially could cause economies to slow down if people, you know, are very afraid of doing business in Africa or coming to Africa, etc.
They shouldn't be afraid. Look, we have a situation where the Ebola is there. Follow the simple rules. Do not get contaminated with your fellow person as much as possible. Human-to-human contact, it's a no-go area. First of all, you must understand that. But if you go into Liberia, right now we have hotels closing down, offices closing down, the schools are closed down. And if we continue that way, the economy is going to go down, also downhill. How do we resurrect that? That is a problem we're having, a major problem. We need all hands on board at this time.
What do you need right now?
We're having help from all over the world, I must say. And for this, we're extremely grateful, headed by the United States. We have the UN coming in there. We have Germany, China, Norway, and whatnot. But what we will need, proper coordination. We have the UN, you have UNMIL, that's another branch. You have the WHO, then you have the Ministry of Health, then you have the US military. Who's taking instructions from whom? That's something we have to sit and coordinate it properly. That's what Liberia is looking for.
On that note, Ambassador von Balmoos, thank you very much indeed for being here.
Thank you, man.